Dr. Jaffe, this is a three-part question on PERQUE Endura PAK Guard. We know that glutamine can, the effect that glutamine can have on anxiety-prone individuals, so those who have seizures. So the PAK in Endura PAK Guard, what does it do to the glutamine? Is it protective? And what is the effect of long-term use of this combination on those who are anxiety-prone? And do you recommend cycling on and off for certain individuals?
Well, there's a lot in that question. The recycled glutamine is recycled with the use of PAK. PAK is pyridoxal alpha-ketoglutarate. That is helpful in keeping the glutamate down and the glutamine up. This glutamine is used by enterocytes, the lining cells of the intestines. If you look at plasma amino acid, glutamine, glutamate, other essential amino acids, there's no effect. When you put 1.5 grams of glutamine and half a gram of PAK in a dose, and you follow that over time, you see no effect on the plasma levels of amino acids. From this, we conclude physiologic adaptation, adaptogenic use of glutamine and PAK. You must have the PAK, otherwise you don't recycle the glutamine. So in that sense, you can think of the PAK as adaptogenic. It helps the activity. It does not create dependency. Now, part of the question is, should you cycle? Things that can cause tachyphylaxis, things that can cause adaptation, should be cycled so that the adaptation does not occur. Things that are adaptogenic, glutamine as the energy source for the enterocyte recycled with PAK, is very different. It's physiologic. It's not inducing anything. It is allowing physiology to function. Thus, taking it every day is important. Consistency is important. And there is no value in recycling or cycling, going on and off the glutamine. Now, what about seizures? There are many causes of seizures. None of them are harmed by Endura PAK. Many of them are helped by Endura PAK. The answer to the question of will an individual with seizures benefit from the product is known by taking the product. There are so many causes of seizures, some of which benefit from glutamine recycled with PAK, many of which are not benefited or harmed. And there's no situation that I know of as a clinician that's a contraindication. There's no kind of seizure disorder that's made worse by recycled glutamine. So we are concerned about people who are anxious. We are concerned about people who have seizures. With seizure disorder, it's fairly straightforward. If it helps, there are less seizures. If it does not help, there are not less seizures. Now, with regard to anxiety, the combination of Endura PAK Guard, Mood Guard, and Sleep Guard, often with supplemental ascorbate and polyphenolics and supplemental magnesium choline citrate, are worth using as a combination therapy in people who are anxious. But as we said about seizure disorder, Anxiety comes in many, many different flavors. I would say 40% of the time in anxious people, this helps them calm down. The combination that I mentioned, bringing it all together as a suite of products, as a combination of products, benefits about 2/3. 1/3, unfortunately, this is not where the problem is, and therefore this is not the solution to the problem. But 40% is pretty good. And 2/3 is even better when you combine synergistic components of PERQUE, the PERQUE Endura PAK, the PERQUE Mood Guard, the PERQUE Sleep Guard, and think about ascorbate. We know that pro-oxidants are harmful. And one of the ways in which they're harmful is they create anxiety. So in that sense, having enough ascorbate and magnesium choline citrate to reduce those chemicals can be helpful. So we think we know the mechanism, we know the observation. Seizure disorder, anxiety disorder covers a lot of territory. What I want to emphasize is that the PERQUE will be helpful and will be noticeably helpful if they are helpful, that the combination works better than individual components, and most importantly, there's no risk. These are adaptogenic, these are physiologic, these are useful and helpful, and they never go outside of physiology, outside of homeostasis, outside of bringing the system into balance. So it's a different way of thinking when you use adaptogenic formulas. So you're now thinking about supporting with physiology, not pushing with pharmacology. And that is the fundamental difference. With PERQUE, we always respect physiology, and we are a little skeptical of pharmacology. So physiology before pharmacology and physiology in combination will likely work better than alone.